I've had the opportunity of chairing 3 subcommittees in appropriations, and the chairmen are called cardinals. So I've been a cardinal 3 different times, which is certainly a great honor. I was the chairman of the legislative branch subcommittee, and that's sort of the inside baseball committee. It's the one that does the funding for Congress itself, House and Senate, the Library of Congress, the General Accounting Office, the Architect of the House, the Botanical Gardens, and some of the other, the Capitol Hill Police, and then some of the other agencies that directly deal with Congress. And then and Jim Moran from Virginia was our ranking member on that. And very proud to say I worked with Jim. We held the spending down. We cut it slightly one year, and the next year we held it to a very minimum in terms of the increase. And then I was chairman of the Agriculture Committee. Rosa DeLaura, who had been chairman, became the ranking member, and we kept spending down and cut spending on that. And then I moved over to Labor, Health, and Human Services, and that's a huge subcommittee that funds all kinds of social programs, from Social Security to Medicare to Medicaid to Obamacare to the Center for Disease Control and the National Institute of Health, and education programs and labor programs. And because of that, it's a committee that the liberal Democrats really like and the conservative Republicans really dislike. And when you're the chairman of it, you're caught in the crossfire between the two ideologies, and your job is to move legislation, but to kind of keep the criticism to a minimum and to get the thing done. And I can tell you, probably, one school of thought is you don't spend enough money, and the other one is you spend too much money. So it's very difficult to get the bill moving. But we worked very hard on it, and one of the things that we got involved with were some of the diseases. For example, polio. We have all but wiped out polio. As a former member of the Rotary clubs, the Rotary International has made polio eradication one of their big causes. The Gates Foundation has too, and the CDC has. So you get a government agency, a private foundation, and a group of civic clubs all conversion on this. And we had the ability to work with Bill Gates. We met with him several times on, what do we need to do, and in 2013 got polio cases in the world down to 22, isolated into 3 countries, Pakistan, Nigeria, and Afghanistan. And then unfortunately there was some migration and the number went up in the hundreds, but it still was low compared to where America was in the 1930s and 40s, when just about every child's parents' biggest fear was polio. So we've come a long way as a nation on the disease, and working with them on polio eradication was certainly very satisfactory. The Ebola outbreak came. We worked with the CDC on Ebola, and also with the companies on trying to develop an Ebola vaccine. We're not there yet, but I'm confident that we will be. The National Institute of Health does a lot of grants with some of our universities. We were able to bring them to Atlanta and held a kind of a summit at Emory, and had many of our research universities from around the state participate in it. We brought Francis Collins down, who's the head of it, and talked about where we need to put more research, where are we being successful, where is it that we can cut back. And one of the examples is Usher syndrome, which is a really obscure but a very sad disease where children are born normally, but they quickly lose their hearing. Then when they reach puberty, they actually lose their sight. And there's some children with Usher syndrome in the state of Georgia. So we were able to elevate the awareness of Ushers, not at the expense of some of the larger diseases, but just in terms of research, making sure that the NIH wasn't forgotten those, because people like that have a tendency to fall through the cracks because they don't have the political advocacy groups that some of the bigger diseases have. And we were able to, I think, strike a good balance with it, and we worked with the Republicans and Democrats alike on it.